Hi, if you are a medical student or a student studying in any health science field, what would be the first thing which comes to your mind when someone asks you which is the tumor associated with smoking? I think for most of you, the first thing which comes to your mind is lung cancer, right? Because the association of smoking and lung cancer is so strong that you often equate smoking and lung cancer. Now, what if I say there is another tumor in our body which was often referred to as the smoker's tumor? Do you know which tumor is that? And luckily, that is the benign tumor. Yes, that is Warthin tumor. Hello, everyone. Welcome back to this short tutorial from Pathology Made Simple at ilovepathology.com. In this short tutorial, let's learn about Warthin tumor in terms of its epidemiology, the pathogenesis, clinical features, how we diagnose Warthin tumor, the morphological features of Warthin tumor, particularly the gross and microscopic features, and a bit about treatment of Warthin tumor. By definition, Warthin tumor is a benign salivary gland tumor. In my previous session, I had talked about another important, very common benign salivary gland tumor, right? That was pleomorphic adenoma, whereas this one is another benign salivary gland tumor, which is composed of oncocytic epithelial cells, which lines the ductal, papillary, and cystic structures in a lymphoid stroma. We will understand this a bit later. Now, you have to concentrate on these two important features in Warthin tumor, that is, presence of oncocytic epithelial cells. Now, what do you mean by oncocytes? Because for most of us, onco is synonymous with cancer, right? For example, oncology is study of cancer, right? Onco means cancer, but this is not a cancerous cell because onco was derived from the Greek word called onkos, which means mass or bulk. So these cells are the ones which are very large and they had a very high mitochondrial content. It has got nothing to do with the malignancy, right? So because these were large and bulky, they were often referred to as oncocytes. They can be seen in benign as well as malignant tumors. That's different. But then in the context of Warthin tumor, these are benign epithelial cells which are known as oncocytes because of their very high mitochondrial content. The second important component of Warthin tumor is presence of lymphoid stroma. We will understand this once we study the microscopic features. So this Warthin tumor is named after this very famous American pathologist, Alred Scott Warthin. It's not just Warthin tumor which is associated by his name. The other important lesions in pathology which Warthin has contributed is Warthin Finkeldy Jane cells which you find in measles, Warthin starry stain, a very important stain in the diagnosis of syphilis, and thirdly Warthin sign, which is basically an accentuation of the pulmonary second sound, and that is an important sign in the diagnosis of pericarditis. So remember, whenever you come across Warthin tumor, you need to also know these three important contributions from Alfred Scott Warthin. This was also referred to as adenolymphoma, papillary cystadenoma lymphomatosum, and cystadenolymphoma. But remember, these are the earlier terminologies. The WHO or the World Health Organization says do not use these terminology for Warthin tumor anymore, right? This is the second most common salivary gland tumor. What was the most common salivary gland tumor? Yes, that was pleomorphic adenoma, right? So this is the second most common salivary gland neoplasm, which almost exclusively arise in the parotid gland, and they are more commonly found in males as compared to that of females. They're usually seen in fifth to seventh decades of life, and majority of them are unifocal. Okay, around 10% are multifocal, and around another 10% are bilateral. Most often, the most common one is single parotid gland and single site within the parotid gland. Now, what are the risk factors? I'm sure by now you would have known that smoking and Warthin tumor has a very strong association, just like lung carcinomas. The other important risk factors are radiation exposure, which is found in atomic bomb survivors, and it is also found to be associated with various autoimmune diseases, particularly thyroiditis. What is a pathogenesis? It's Not really known, but then it is often said that probably arises from the salivary ductal inclusions in the lymph nodes within the parotid. How do these patient manifest or present? They are usually present with painless, slow growing mass. Sometimes it can be fluctuant. So once you have a parotid swelling and once you elicit that, you have a very strong smoking history, the clinician would probably go in for an early diagnosis, particularly by the means of FNAC cytology. In cytology, what do you see? You see sheets of oncocytes, which are those large cells with abundant mitochondrial content, which cytologically seen as large granular cells. They are oncocytes. Apart from the oncocytes, you also see numerous small lymphocytes and a very small number of larger lymphoid cells, and the background is granular and dendritic. Now, once the tumor is excised, this is what the gross feature look like, right? It has a capsule. See, you can make out this is a normal salivary glandular tissue, and this is the tumorous part. It has a capsule and it has both solid areas and cystic areas. The papillary excrescences are seen extruding into the cyst-like spaces. And the fluid is, fluid is basically brown, viscous fluid. Sometimes it is also referred to as machine or motor oil appearance. The fluid is dark brown and viscous, and that's why it's also referred to as machine or motor oil appearance. So, microscopy is very simple. All you have to identify is varying proportions of papillary cystic structures which are lined by bilayered oncocytic epithelial cells. So these epithelial cells are bilayered, outer cuboidal and inner columnar, and these are surrounded by a lymphoid stroma including germinal centers. Can you see this? So this is the bilayered oncocytic epithelium which I was telling about, the outer cuboidal and then inner meaning the lining epithelium towards the cyst-like spaces. So these are columnar cells, and I told you these are oncocytic cells. They have abundant granular eosinophilic cytoplasm, and that is because of they contain abundant mitochondria, and that's why they are granular in appearance in H&E stain slides. And these epithelial cells or this epithelium is surrounded by a lymphoid stroma. And this lymphoid stroma often has prominent germinal centers as well. So let me try to illustrate as to how to draw Warthin tumor if you are asked in the examination. What you have to do is just line these spaces and write the outer cuboidal and inner columnar epithelial cells. Add the nucleus to each of these cells. Remember, the nucleus is centrally located in each of these cells, and that's because of abundant mitochondria, which makes these cells look larger and granular. So, this granularity is was what I am depicting here. And then add the lymphoid stroma containing varied proportion of lymphocytes, transformed lymphocytes, and you can even add germinal center. So, illustration of Wadin's tumor is extremely simple, isn't it? Add some content in the human. So that completes Wadin tumor histopathology illustration. How do you treat these tumors? It's very simple. Complete surgical excision with adequate margins is usually curative. The chances of recurrence are extremely unlikely. So that completes Warden tumor. We talked about the epidemiology, the pathogenesis, clinical features, the diagnosis, morphology, and treatment of Warden tumor. If you have liked this video, hit the like button. Do comment if you have anything to ask, and also comment as to what kind of tutorials should I be taking up in future. If you find this video useful, please do consider subscribing and don't forget to share so that your friends also will get benefit out of this. Thank you.